Hello everyone. Today we are going to discuss non-steroidal anti-inflammatory drugs by Professor Sabah Sheikh. So first we'll see what do you mean by NSAIDs. NSAIDs, the full form of NSAID is non-steroidal anti-inflammatory drugs. So all the drugs grouped in this class have an analgesic, antipyretic and anti-inflammatory action in different measures. In contrast to morphine, they do not depress CNS and do not produce a physical dependence. That means it is safer to use NSAIDs. Now we'll discuss the classification of NSAIDs. So NSAIDs are broadly classified into four different categories. First one is the non-selective COX inhibitor. These are the traditional NSAIDs. Second one is the preferential COX-2 inhibitor. Third one is the selective COX-2 inhibitor, and the last one is analgesic antipyretic with a poor anti-inflammatory action. Let's see each class one by one in detail. Now we'll see the mechanism of action of NSAIDs. So cell membrane phospholipid are converted into arachidonic acid in the presence of enzyme phospholipase A2. Then this arachidonic acid basically follows two main pathway. One is lipooxygenase pathway and second one is cyclooxygenase pathway. In lipooxygenase pathway, it will form a leukotriene which is involved in inflammation and allergy. Whereas in cyclooxygenase pathway, it will form prostaglandin, prostacyclin and thromboxane, and this will which causes the pain, fever, inflammation and help to protect the stomach and the platelet. So ideally, our drug, which is nothing but NSAIDs, it will inhibit this cyclooxygenase pathway. As a result, pain, fever and inflammation decrease, but blocking COX-1 can also reduces the stomach protection, leading to side effect like ulcer. Why? Because COX-1 participate in physiological, which is nothing but the housekeeping function, such as secretion of mucus for the protection of gastric mucosa, homeostasis and maintenance of renal function, while those produced by COX-2 lead to the inflammatory or and other pathological changes. That's why when we use the traditional NSAID, there will be the side effects which is related to the GIT. Now, we'll see one by one the classification of NSAID. The first one is the non-selective COX inhibitor. So, first we'll see the mechanism of action. So, non-selective COX inhibitor inhibit both COX-1 and COX-2 enzyme, decreases the prostaglandin synthesis, decreases the pain, fever and inflammation, but may cause gastric irritation because it inhibit the COX-1 enzyme also. It includes salicylate, propionic acid derivative, phenamate, enolic acid derivative, acetic acid derivative, and pyrazolone derivatives. Now the next class of drug is the preferential COX-2 inhibitor. We'll see the mechanism of action. So preferential COX-2 inhibitor inhibit COX-2 more than COX-1. It provides the anti-inflammatory and analgesic effect with a less gastric secretion because it has a major effect on COX-2. It includes the drugs like nimesulide. Nimesulide is a weak PG inhibitor. It moderately COX-2 selective inhibitor used for short-term painful inflammatory condition and fever. The next is the diclofenac. Diclofenac is analgesic, antipyretic, moderately COX-2 selective inhibitor, inhibit the PG synthesis with a minimal antiplatelet effect. Then aceclofenac, COX-2 selective derivative of diclofenac with a similar action. Then meloxicam, it is a new piroxicam derivative. It moderately COX-2 selective inhibitor. Then etodolac, it is a new NSAID and it is again a moderately COX-2 selective inhibitor similar to diclofenac. Now the next class is the selective COX-2 inhibitor. So we'll see the mechanism of action. So selective COX-2 inhibitors selectively block COX-2 enzyme, strongly reduces inflammation and pain while sparing the gastric mucosa and platelets. So it is basically this Selective COX-2 inhibitor, highly selective COX-2 inhibitor spare the COX-1, causing less gastric damage and lower risk of ulcer or bleeding. They do not have an effect on platelet activation or production or aggregation, but reduces the endothelial PGI synthesis. So basically this selective COX-2 inhibitor, it has the advantage that it will spare the gastric mucosa irritation, and also it will there will be no effect on the platelet. Now the last one is the analgesic and antipyretic with a poor anti-inflammatory action. So the first one is para-aminophenol derivative. The example is paracetamol. Most of the time we take paracetamol as analgesic. So recent research show presence of previously unknown COX-3 which found in the brain and spinal is inhibited by paracetamol. Paracetamol does not produce any GI side effect. Second one is pyrazolone derivative. The example is metamizole and propionate. Metamizole inhibit the COX-3 with a higher affinity compared to COX-1 and COX-2. And the last one is a benzoxazine derivative, that is nifopam. The mechanism of action is this still unknown. So this is all about the NSAIDs. Thank you.